occupied with pathology. An electronic search in psychological abstracts since 1887 revealed 8,072 articles on anger, 57,800 on anxiety, and 70,856 on depression. While only positive emotions, we have the content which were 851 abstracts on joy, 2,958 on happiness, and about 5,700 on life satisfaction. In this example, negative emotions trounced positive emotions by a 14-to-1 ratio, even greater than the 7-to-1 where treatment exceeds prevention. So Martin Seligman stated that positive psychology is not just the study of weakness and damage. It is also the study of strength and virtue. Treatment is not just fixing what is broken. It is nurturing what is best within ourselves. And why this positive emotion, positive psychology is important? Number one, pathologizing does not move us closer to the prevention of serious disorders. Number two, there is a set of human strengths that are most likely buffers against mental illness, like courage, optimism, interpersonal skills, work ethics, hope, honesty, and perseverance. Much of the task of prevention will be to create a science of human strength whose mission will be to foster these virtues in young people. Number three, brain has left the mental health professional ill-equipped to do effective prevention. We need massive research on human strength and virtues. Number four, we need practitioners to recognize that much of the best work they can do is amplifying the strengths rather than repairing their patient's weakness. And number five, although the other sub-areas of psychology were not focused on human weakness, 20th century's applied psychology and psychiatry typically were. For example, consider the statement attributed to Sigmund Freud that the goal of psychology should be to replace neurotic misery with ordinary unhappiness. So these five topics, we will go through them throughout this course. So a balanced view of human functioning is pathology approach is not wrong, but it is incomplete in its portrayal of humankind. Undeniably, the negative is part of humankind, but only a part. Positive psychology offers a look on the other side, which is good and strong in humans. And future psychologists must develop an inclusive approach that examines both the weakness and the strengths of people, as well as the stressors and the sources in the environment. So historically, if we see positive psychology, we can see that in 1900s, in 20th century, life expectancy in USA was 44 years. Most died suddenly in infancy. Many women died during childbirth, men during their jobs, and from diseases like diabetes, tuberculosis, flu. So psychologists did understand that the real killers are lifestyle choices rather than a long but frail life. Issues about quality of life are more important than whether we survive infancy, childhood, or a killer disease. A longer life with the last 10 years frail, maybe less useless. Secondly, the medical science transformed life with treatment for mental and physical disorders. In 1947, National Institute for Mental Health in USA was established to deal with the mental health problems, focuses attention on solving problems and on the negative. Next is there was an era of mass migration from rural to urban settings, as a result of which communication and transportation become more advanced. Common urban crowding, stress-related disorders, and recently, University of Pennsylvania, one of the prime psychologists, was the founder of positive psychology, Martin Seligman, should be singled out for having ignited the recent explosion of interest in positive psychology, as well as for having provided the label positive psychology. So let's not